Welcome to Medical Health Institute. We are excited about your journey. In this video, we'll be explaining how to mix peptides like samorelin, ipamorelin, CJC 1295, or any other type of peptide that you might be using. Now, typically you use bacteriostatic water for human growth hormone, HCG, and peptides. However, HCG is the only one that can be either mixed with bacteriostatic water or sodium chloride. So I ask you to please be careful when you do receive your package, if you are doing peptides and HCG, to make sure you do not mix the peptide or growth hormone with sodium chloride. Sodium chloride, once again, is used only for HCG. But bacteriostatic water works for the three of them, which would be growth hormone, human growth hormone, peptides, and HCG. So here we have the bacteriostatic water. Here we have a peptide vial, the mixing syringe, the injection insulin syringe, alcohol swab, and a variety of syringes, insulin syringes. So typically for HCG, HGH, or peptides, you use a 30 or 31 gauge. Now the 30 gauge, half an inch, is a little thicker than the 31 gauge. And the 31 gauge is a little thinner, and the needle tip is a little shorter. So we typically use a 31 gauge because this is gonna be done subcutaneously, meaning you're gonna be injecting the fat. So now we're gonna grab the bacteriostatic water, take off the safety cap, grab the mixing syringe, uncap the mixing syringe. We are gonna extract whatever amount of water is prescribed on your instructional email. So you typically wanna do this at a 90-degree angle upward. But for the purpose of the video, I am showing it to you at an angle. Once you're done with the extraction, put the bottle of bacteriostatic water back down. Uncap the safety cap from the peptide. Uncap again the mixing syringe. And then you're gonna hit the needle tip right in the middle of the plunger, and you're gonna push the bacteriostatic water liquid inside. Once it's done, pull it out, cap the syringe again, and you'll typically find that inside a peptide HCG or HGH vial, it's a powder form. Once you mix it, you don't want to shake it brusquely, you just want to swirl it. And you'll swirl it until you'll see that the liquid is nice and crystal clear. Once it's clear, it's ready for injection. If by any chance the liquid clumps up and it's cloudy and white, that typically is because you mixed the medication with the wrong water, which in this case, if you mix a peptide or growth hormone with sodium chloride, it will clump up and get cloudy. If you see that, please call the clinic, speak to the doctor, or call the pharmacy directly and tell them what the issue is. So now, to inject, you'll take off the safety cap from the insulin syringe. From the prescribed dose, let's say you were prescribed 50 units. For the purpose of the video, we're just gonna do it up to 50 units. You wanna fill the syringe with 50 units or whatever amount prescribed by the doctor with air first. Once you fill it with air, put it right in the middle of the plunger, push it in, inject the air into the vial, and then you're ready to extract. You wanna again do this if you can at a 90-degree angle upward, but for the purpose of the video, I'm doing it at an angle. Once you're done, you wanna grab the syringe and flick it for any air bubbles for them to come up. Once they come up, you push the plunger up until one drop comes out, and you're ready to inject. You cap it back on if you're not ready to inject, and you store it in a cool place until you're ready. Now, we also sometimes have patients that will grab a prescription vial or a cup like this, and they'll pre-fill their ipamorelin or human growth hormone syringes a week at a time, so they don't have to be extracting and injecting every day, going through the whole process. They just pre-fill them, put them in a cup, put them in the refrigerator. So once you're done injecting, you want to discard of the insulin syringe into a sharps container. You can either get this from us or you can buy it at a primary pharmacy like CVS or Walgreens. You basically uncap it, dump the syringe after you inject it, and you are done. You clean the area around the belly button. And for the purpose of the video, I'm using B12, a small amount, so it's not an issue. You're gonna make sure, obviously, as we showed you before, to make sure that the needle tip has no air. And when you're ready to inject, you're gonna squeeze the skin. Some patients like to go in sideways. We recommend to go right in. You can either dart the skin or place it on the skin and inject. So it's painless. You do not feel anything. You inject slowly. Once you're done, you pull out, put the cap back on the syringe, and you are done. The secondary option you have to inject subcutaneously, and that a lot of our patients like, is to the love handles. So same process, you squeeze the love handles. You can either dart the skin or place the tip and inject slowly. Go right in and just push the medication in. You take the medication out, put the needle tip back on, and discard it, and you're done. So you put the cap on. If our doctor prescribed you 2 or more supplements, then we strongly recommend that you buy a multi-week vitamin packet like this one. Reason for it is to make it easier and more convenient for you to take your supplements. So typically you would fill from Sunday down to Saturday your AM and PM supplements. Our doctor typically divides most of the supplements into AM and PM. Or some like magnesium, he would only tell you to take it PM. But we strongly suggest that you buy one of these multivitamin weekly packets. So once you have your multi-week vitamin packet, and let's say the doctor prescribed you 4 capsules of a certain supplement and he told you to take them 2 AM and 2 PM, then we recommend when you have your supplement vial, get a Sharpie pen and mark down basically how many you're taking per day. In this case, it would be 4. And then you would place AM and PM. Therefore, you know you would have to divide the dose into 2 doses per day. And that goes on, whether it's 2, you put 1 in the AM and 1 in the PM, and then you would fill in individually each one.